There's a lot of information out there about COVID vaccines because COVID has affected our lives in unimaginable ways. What are the long-term harms with taking the vaccine? And are there any? And could it cause infertility?
So I'll unpack that. So the infertility question have been asked repeatedly, which is why it's been specifically dealt with. But no, there's no data to suggest that it causes infertility. The vaccine hasn't been around long enough to complete a longitudinal study and to establish infertility as one of the possible adverse effects of the vaccine. With regards to the long-term harm, it's impossible for anyone to answer that with any certainty because the vaccine's only been around for a short period of time. But I think the question then is best dealt with if we go back to the fifth of the six principles that I mentioned earlier, that our judgment in matters of medicine are based on probability and not certainty. So we don't know, but what we know currently is that it's unlikely to cause any long-term harm, but the immediate benefit is undisputable. So we should take the vaccine from that point of view, in that, look, we are now, if we entertain these questions, then we are starting to then indulge in triviality.
And in that event, how do we deal with all the misinformation that comes our way?
Look, it's hard to deal with individual conspiracy questions, but what I'd like to highlight is the harm that a conspiracy will cause. If we step away from COVID for a little bit, just briefly, and we look at measles vaccination and autism. So some of you may already be aware of this, but a gentleman called Andrew Wakefield published a poorly designed study in a very reputable journal in the late 90s, and falsely or mistakenly, whatever the case might be, showed an association between taking a measles vaccine and a child become autistic. It was a small sample of 12 infants. The data has subsequently been discredited. Andrew Wakefield no longer practices. And there have been studies after that have been much larger, that have shown no association between the measles vaccine and autism. But unfortunately, the damage has been done. And 25 years down the line, we're still seeing anti-vaxxers who use this data to then not vaccinate their kids against measles. And as a result, in the last 5 years, in 2000, measles was eradicated from the US, but in the last 5 years, there have been annual outbreaks of measles in the US. And a lot of this stems from the fact that people now are not vaccinating their kids against measles. So dealing with conspiracy theories from a slightly different angle, this is the sort of harm it can cause. And this is how long-lasting misinformation can be. And it's... I'd like to remind everyone that one of Islam's greatest achievements is a scholarly tradition and our ability to verify information and to assess the reliability of the sources of that information. And we're all inheritors of that tradition. And we should remember that when we're dealing with conspiracy theories. And if you come across a text or a meme, don't forward it. Just take it to your local imam or your local doctor or someone you trust, and discuss it with them and try and verify whether this is true. But I think the best or the best deterrent to this is probably Surah Luqman, verse 17 in the Quran. Allah subhanahu wa ta'ala says, Ya bunayya aqim as-salah wa'mur bil ma'ruf wanha anil munkar. O my son, establish prayer, enjoin what is right, and forbid what is wrong. And I think we need to remember that when before you spread a conspiracy theory, because you're harming the community.